Yeah. So can we go ahead, sir?
Yeah, go ahead.
Yeah. Welcome all to the seventh episode of podcast series that was conducted by FCPI. So today we have an eminent person, Dr. Murlidhar Verma, sir, who is going to talk on soft skills that are required for the clinical pharmacist in hospital clinical rounds. So which these are like something low hanging fruits which are need to be focused. So I hope sir is the best person, and sir also have more than 10 years experience in current infectious diseases, and also he is working in Manipal Educational Institute and also in the hospital. He is having a eminent team of microbiologist, IT person, and also a group of great people who are included into AMSP. So now also sir had many papers under his name and citations. I welcome you onto the stage, sir. So please kindly take the session forward. We request. I hope today the session is mostly it would be on how the communication is important for a clinical pharmacist on clinical rounds when dealing with the multidisciplinary teams. Myself, I'm going to address few challenging situations. We need your expertise on it, sir.
Okay.
Yeah. Firstly, I just want to start with academia, sir. So, when you may be having a great experience dealing with MBBS students, and followed by, you are also having a chance, we are having a chance to meet you on rounds, I mean, formally these days. So, what the differences you can identify between MBBS students and what that should be inculcated by Form D that would help for them to enhance their prospectiveness towards the career objective? So could you please address this, sir?
Yeah, so if you look at MBBS, I've been teaching undergraduates for almost like 25 years now, right?
Yeah,
So
yeah,
from being a junior faculty to what I'm heading the department. So it's almost like 25 years we have seen. So there is a fundamental difference between an intern coming from pharmacy stream when somebody is coming from an medical stream. Okay, first thing you need to understand is if somebody is coming from medical stream in internship, it is
yeah,
important that they learn lot of skills. Communication and understanding is only one stream. Like
yeah.
they need to know to do procedures, they need to know how to write discharge summaries, they need to assist in surgeries, right? And they are also
Yeah.
posted not only in hospitals in ours, like, but they are also posted in the peripheral hospitals where they
Okay.
engage with communities, right? They go
Okay.
to the primary healthcare centers. So their internship is at a different pathway, right?
Okay.
So, and their necessity skills required there is completely different.
Okay.
And then the other important thing is legal aspect for it. So when you become an MBBS doctor, you have
Yeah.
legal right to do certain things, right?
Exactly.
So that is what hospitals look at. So when an intern joins, they get certain salary, they are legally allowed to do certain things, but under supervision of something.
Yeah,
So
exactly.
if you go to somebody who is a clinical pharmacist, that legal framework is not there to protect them or what sort of things. Because
Yeah.
in
Yeah.
India, unfortunately, nobody looked at this as a comprehensive package. So neither
Exactly.
the clinical pharmacist organizations never actually engaged them with IMA, Indian Medical Association, right? I think
Yeah.
they were parallelly running two streams. It's very unfortunate. They should have done 20, at least 40, 50 years back. I'm sure things would have got integrated, or at least 20 years back when it is clinical pharmacy started. So that is a fundamental difference people need to understand when they do internship. So that can easily be reflected when pharmacy interns come.
Yeah,
See, as
exactly,
I
sir.
told you, if an intern joins, he is answerable to somebody, right? Like when he does something, I'll call him certain time, he has to come, let it be Sunday evening, he has to write. I have to mark his attendance. I have to see his performance like that. He's answerable to me.
Yeah.
When
Exactly.
pharmacy interns come, they have no clue who they should answer, and their own faculty don't come,
Yeah.
right? So obviously, when you're not monitored, that's how human behavior is. It is like when I take a class and then students know the teacher is not there. You've seen how students behave in the classroom, and moment teacher comes, how they behave. That's a classic example. That is exactly what
Yeah.
happens to clinical pharmacists. A small section of them are self motivated. We can clearly see they go extra yard to learn, but that will be
Exactly,
a
sir.
minority of it. So, according to me,
Okay.
it's a system problem. See, unless your faculty also join rounds and work with us, this is never going to improve, according to me. And this is what I've been insisting for long term. It's because we
Exactly.
have 10,000 other things to do. Somebody is helping this thing. As an intern, it's not that we're sitting and teaching MBBS intern. They're supposed to do work, we check that, right?
Yeah.
So, whereas pharmacists, it is like an appendage to me, extra thing, which I need to spend extra time. 90-95% of the clinicians won't look at that unless you're in a corporate hospital where intern's job you're taking over, like writing orders, because they want to cut money by employing doctors. But in
Yeah.
institutes or where you're passing out, if you see that system is not in place primarily because the college which is giving you the degree, that faculty is not engaged during your internship for the clinical work. I think that's a
Exactly.
fundamental flaw in this whole system. I've been telling this for many years. I don't think so anybody wants to rectify it.
Okay.
Yeah.
Because I post this question because, sir, even if you cross-check the prefix, the person who completes MBBS, they have a prefix of doctor. The person who completes Doctor of Pharmacy, they have a prefix doctor. But there is a lots of difference between these two degrees. So I hope this is one of the thing that I want to just know. So yeah, it's true, sir. The what and all you are saying that need to come from the roots. Exactly, sir. And also, sir, when we are talking about the communication and followed by how to approach the daily challenges, how do you feel, sir, like something that former background students need to start from the roots? I mean, from the day one when they enter into the curriculum. So, what and all things that makes them to be very courage enough to speak and also to deliver what and all the things regarding clinicals. So, what is your point on this, sir?
So, as I told you, see, there should be some sort of integration at the curriculum level into the clinical side. So, even though you're
Exactly.
saying clinical pharmacist, until you reach final year, you have no clue how hospital works, what is
Yeah.
OPD, how orders are written, how doctors function, how blood is drawn, how ICU patients react, how do we take history. 95% of all the students who come in final year only, just first time they're entering hospital, which is too late in the day. So, like
Yeah.
MBBS, if you look at it, they start their clinical posting in second year and goes on for 3-4 years. So by the time they
Yeah.
finish their internship, they've effectively spent 4 years on the clinical side. System
Exactly,
should
sir.
integrate at that level, right? And then
Okay.
bit by
Yeah.
bit by bit. So what happens is you are posted in final year, then you have some exam, then again you come in internship, that took a couple of months, then go off. So there is no continuity and structured system to learn. And your
Okay.
SSC is somebody who is have no clue about what is happening to the patient. And the
True.
person who is seeing you day to day has no interest in you, right?
Okay.
Yeah, so
Exactly, sir.
there is a complete parallel things which are happening. So I think that is the biggest irony about your clinical postings.
Okay. Okay. Sir, generally we'll be saying, day that is planned with a good routine would end up in a good day, or that would result you a fruitful results, right, sir? So, in a same way, for a clinical pharmacist background or something who are the students who are pursuing Form D or bachelors in pharmacy, what kind of routine or what kind of activities can help them to enhance their standards, sir? Could you please comment on it?
I think there is a way out. I think first thing is they should early in their course, I think they should be exposed to hospital systems, like how hospitals are run, who are administrators, who are the consultants, who are junior doctors, how nurses work, how housekeeping works, who are the people who are running the show, like operations team from MS Office, how do
Yeah,
pharmacies work, right? How do labs work? How reports are collected? How so those systems in the hospital has to be taught right from probably second year, if not first year.
okay,
Then they should be start integrating into the clinical courses like small groups. In big groups, nobody will look at it. One or two students per unit or some department, they should be posted and see how it works. And
yeah,
then slowly they, by the time they reach final year in internship, they got full exposure of how it is happening.
exactly.
That is the model which will help them, and that is the model they will try to understand, okay, this is what it happens and how do I fit into this whole system, where is my role in that. I think that
Mhm.
clarity should be very important. How, what is my role? So, as I told you, legally you will never get a right to treat a patient, right? Because
Yeah.
only medical doctors will get. But you have
Yes, sir.
legally certain rights. So you have to be able to utilize it by integrating system early and then plan it correctly. So they don't ask them to suddenly attend a rounds, which is even for an MBBS student is so tough. They won't understand what we do in the rounds. So
Okay,
if they start early and understand how systems work, slowly, they will try to get used to it. That is the way I think it is should be integrated. And then probably a faculty should come in, have some sessions together with the clinical faculty. That's integrated clinical teaching is also important. That I don't foresee many of the colleges do, where a clinical staff is there, clinical pharmacy staff is there, and patients are presented in them their role.
okay.
Yeah, that sort of modeling should happen.
Noted, sir. Okay. If I remember correctly, you mentioned like you have visited even abroad, sir. So you would have observed the difference that is happening there and what it is happening here. So, is there anything that we can do or take a baby steps and work on this particular concern, sir? Do you have any suggestions on this?
Yeah, if you look at abroad, I've been doing some fellowships. I spend some time whenever I go, once in 10 years I go visit, or once in 8 years. So how system works is they have a clinicians and they have clinical pharmacists. All of them take rounds together. Their students also come, their faculty comes. And in fact, the onus of uh, preparing the drug, dispatching, monitoring them is completely on clinical pharmacists. That happens
Okay.
at the governmental level, system level. So that is why it
Okay.
has to be done by them. So I think the first step is somebody from the pharmacy side has to start doing that, right? So the
Yes.
baby step for that will be at a micro level. The department should nominate somebody. Okay, weekly, this many days we'll all attend rounds along with students.
Yeah.
Because a student, first of all, you need to understand. Like for example, when I took today, I took one class for MBBS. Many things they have no clue, right? How
Yeah.
hospital works. That's why I keep teaching them clinics. If an MBBS student level is like that, how do you expect a pharmacy student who has not taken a history, how to examine a patient, has no clue, suddenly joining and trying to understand what is happening in the rounds? It is impossible. So
Exactly, sir.
I think if somebody can start a system where they attend rounds and have a healthy discussion, that at least
Okay.
at one unit, I'm more than happy to do. But they have to come forward every time I write letter. So
Yeah.
that will be the first step, and show the success to it, and other clinicians will like it then. That is how you get into
Ex-
clinicians' mind, because you're taking away some of their headaches. They'll be more than happy. And that model can be used for other systems in the hospital, then from the hospital to other hospitals at different levels. That's how it should spread. And show this success
Okay.
story in the pharmacy conferences, in Indian
Yeah.
conferences. There is
True.
nothing in pharmacy conference which talks about this systems in place. Everybody talks about drug errors, everything. Fine, but how much are you actually contributed to it? Because for our students will come, I want conference one case report, either MBBS. That is not going to take you for a long-term uh, outcomes. So it has to happen like how the certain system improved, right? How it has
Exactly.
engaged, sharing these personal experiences in platforms like a big conferences. It should be at senior level. So those sort of things, and which will enlighten the students who are attending the conferences or CMEs, or I don't know what you call in pharmacy, we call it continuing medical education.
Yeah,
So
same sir.
yeah, so those things of interaction or something like a YouTube channel like this, you're creating awareness. But what is happening is it is happening at a very base of pyramid level. So the viewers who are watching this are all youngsters.
Yeah.
Ideally, these sort of videos should be watched at the admin level who are framing your whole curriculum at national level. I don't know what do you call
Okay.
that. For us, it is NMC, National Medical Council. What is your council called?
PCI, sir.
PCI, yeah. So
Pharmacy
those
Council
people
of India.
should listen to these videos, and somehow you have to take this sort of information to them, either
Yeah.
through your heads, through your colleges, and then have a debates on this. Call
Yeah.
clinicians to it. It is not one time. It should constantly happen. Things will change over a period of time. It's a mindset problem, according to me.
Exactly. Exactly, sir. This is really a good innovative kind of thought. So like initiating this and showcasing on great stages. So how it can impact the fruitful results. True, sir. Thank you for the wonderful suggestion. And now we will jump into the main topic, sir. Sir, a person from, I mean, a student turning out from his academia to a professional journey, starting his professional journey. If you have a team who is having a CP, so how do you think and what is the exact thing that you expect from the CP regarding, because communication is a big challenge today, and if communication is very clear, almost all the problems are sorted out. So, in what way his rounds and also observations, all these things, in what way you'll expect and what way it need to be communicated, sir? What is your expectation from your team member?
Yeah. So ultimately, you need to understand that to answer that question, we need to understand in which health system are you working. For example, if you're working like a hospital where you're working, where it's a corporate hospital, so the
Yes.
systems will work differently. So your job responsibilities will be different. Like, for example, what I understand right now, most of the corporates are doing is instead of uh, employing MBBS, which is costly for them, they are employing primarily clinical pharmacists who are qualified, writing orders, writing discharge summaries, checking medications, etc. Like somebody like a university hospital, we actually don't need them, right? And they're
Yeah.
employing now, but we have a clinical pharmacist who are primarily collecting data, right? And
Yeah.
then using for quality office. They're actually not helping out directly patient care, where you are actually involved in directly. So I think first most important for a clinical pharmacist to understand which hospital system are you working and what is
Okay.
your role there. That is a very, very important thing they need to understand. That's where your red lines are made, right?
Okay.
So many
Yeah.
times in corporate, you are a very important person because day-to-day work will not run if you're not there, right? So, but how do
Yes, sir.
you enhance your position? You enhance your position by showing your skills. Like you pick up all
Okay.
these drug interactions, then you pick up wrong medication orders, right? Other important aspect of clinical pharmacy is completely missed is how do you communicate the drug dosing to the patients, which is massive problem in OPD setup. Like every day I
Exactly, sir.
pick up some errors, not because we have written a wrong prescription. Prescription is right, but patient never understood, and suddenly they miss some drugs or something. So I always have a habit of asking the patient to bring the prescription as well as all the drugs and put it on my table. Every day I pick up some
Okay.
errors. Either the person who is dispensing in the outside pharmacy has made an error, Like ATT, instead of giving a combination of arsenics 300, 450, they would have given 300, 600. So there could be multiple
Okay.
levels. So that
Yeah.
is where clinical pharmacist role is huge. I feel that is where they can educate that patient or create a system where the patients understand the what the doctor is advising and actually what patient needs to do, like giving them insights into what sort of problems if you get, you should immediately come back to doctor, we would have said. But if somebody spends extra time, it makes difference. Like ATT, we always said, if you get fever, if you get yellow color eyes or vomiting, please come back immediately because we are suspecting ATT induced hepatitis.
Yeah.
So similarly, drug errors. So I think that in that interface between a doctor and the drug delivery to the patient, I think that is where I feel is a huge role, which I think most clinical pharmacists are missing their opportunity. It is a lot of effort, but it makes a
Yes,
lot
sir.
of difference. What I do is all the complex cases where we have so many orders, somebody is on antiretroviral therapy, ATT, and there is some immunosuppression going on. We give Dexona 4 mg, patient will be taking 2 mg instead of 3 times. I think those sort of cases, I generally call my clinical pharmacist, you sit and write the prescription correctly and sit and explain them tablet by tablet. Okay.
Exactly.
So those role, I think, is where a clinical pharmacist should make a huge difference. The second thing is, how do you show this impact in real time? I think there should be a system in place where there is a simple software, we document everything and show how it made the difference, right?
Okay.
That
Yeah, sir.
is how the science will evolve, and that is how sort of the relation between doctor, patient, and pharmacist will improve. Okay.
Exactly. Exactly, sir.
Yeah.
So, sir, if something challenging situations happens, for example, you are having a patient and there is a referral to another department, and in between a CP would be acting as a link person to communicate the handover thing or like what and all the complication arised and the reason for the referral. So, if a doctor, I mean, the other faculty is a person who won't even accept CP or won't even understand the presence and the value of CP. So, in these situations, how to do and which communication way will help us to make this channel very smooth?
Yeah, again, I go back to the same thing what I'm telling you. It depends on which health system you're working. This sort of situation will never arise in university hospitals because we will never allow to do that.
Yeah.
Because corporate hospitals are engaging clinical pharmacists, they expect them to do. But what we
Mhm.
need to do is, if a consultant, whether working in a university or working in a corporate hospital, the consultants of same qualification, they're doing basically the same job, right? So
Okay.
if my postgraduate goes and discusses a case with him, they will react differently. If I
Okay.
send my clinical pharmacist, they will react differently. Correct or
Exactly,
no?
sir.
I
Exactly.
feel it's a systemic problem because
Okay.
why will a senior consultant will try to talk to clinical pharmacists? Because many times clinical pharmacists will not understand lot of clinical issues. You might have
Exactly.
enough knowledge around it. Suddenly we'll tell, okay, what does an X-ray show? What happened to the MRI? Okay, what sort of procedure was done? Right? Is the patient's blood loss is how much? So once those questions come, right, what is
Mhm.
happening to the lactate levels? I mean, so many things, permutation combinations. Patient is in altered sensorium. What is a GCS score? I mean, a clinical pharmacist will get lost. Our interns only can't manage. Forget about clinical pharmacists. So I
Okay.
think it is at the system level. If somebody is allowing a clinical pharmacist to do that job, so a
Yeah.
system has to rectify it. In systems like us, in government hospitals, it will never happen because they will not allow you
Okay.
to do it because they are
Exactly.
non-existent. Because your systems are utilizing it, you are facing that problem. So what I would say is it should be corrected systemic level. Second thing,
Mhm.
what can a clinical pharmacist do to enhance it? First, he should enhance the knowledge. He should try to speak in a language what clinicians understand. Many times clinical pharmacists talk in only drug language. That's not going the way
Okay.
we communicate to our patients or us. We always talk in clinical language. What happened to the BP? What is happening to the temperature? We hardly use drug terminologies. So
Okay.
unless you learn that skill, which will take a couple of years, you will always face a challenge. See, how confident are you go and present like a postgraduate, like whole history, like a medical person? You will not be able to do. So that is where the challenge comes, right? So I think those limitations need to be understood, right?
Yeah, sir.
So,
Yeah.
and other thing is, generally clinicians will start liking you if you're doing good job, even if you're clinical pharmacist, but that will take some time. And the third thing is you have to choose. Certain consultant will never be happy with anybody. Even if I go and speak, they will never be happy. I think a clinical pharmacist in this scenario is a worst case scenario. You should never be engaged with them. Should be at even
Okay.
consultant level, it will be challenging. So I think pick
Understood.
and choose and what sort of relation that consultant has to the present patient consultant. I think that's what impacts it. If he says a word, my clinical pharmacist will come and hand over the case. It's fine. Once I put a word, they know who is coming. You have no clue, and all of a sudden you go and talk to them. Are who are you? This is a problem. Go out. So I think that's where the system should work out with.
Yeah, sir. And even the same thing happened once to be, sir, like when like dealing with the diagnostic understanding,
Mhm.
where like student from doctor of pharmacy background won't have a good understanding towards diagnostics, sir. So at least what kind of skills and what kind of to what level up student from this background should have, and how can he can enhance the skills, sir? Is it like by daily rounds, or do you suggest any other so that his things, I mean, conveying the matter or content from non-verbal to medical would be more?
I think that is where you have to learn some clinical skills. It to day work, right? You have to get engaged them. How we get calls for consultations, how we run our OPD, be in the system, learn day to day, catch up that words what we are using, how we interact with the patients' expectations, right? And how patients complain. You pick up something which patients are telling and we are missing it. You can augment that sort of information. I think that is what will help you. Like you have to be in the system day to day and read little by little what are some of the clinical terminologies, right?
Okay,
That is how
understood.
it works out with.
Okay, sir. And also, sir, like another challenging situation, for example, if a doctor is so busy in OPD or any other rounds, and we as a clinical pharmacist want to convey a kind of important intervention or like observation that we found out in the case. So when a doctor is unable to give his attention, though they give, they will be giving 2 or 5 minutes maximum. So how to grab their attention, in what way it should be communicated? Uh, could you please address this, sir?
I think the first step is what is your relation with the consultant? How many years you have been working with them? And
Mm-hmm.
then also, just 1 minute, I got some call or something. Just give me 1 minute.
Yeah, yeah, please.
Yeah. So I think it is important we understand what is the relation. See, somebody is working for a couple of years. I think you can just go into the consultant rooms and talk. That becomes straightforward relation, right?
Yeah, sir.
And are you at the base of the pyramid or are you at either part of the team unit? I have clinical pharmacists right now working for a 1 year course. He just walks into my room and talks to him and goes. That's all, however busy we are. If some
Yeah,
intern comes, I have no clue who it is, what is their knowledge. But the person who is working knows everything about the patient, and we are expecting certain reports to be ready. Because this system, what questions you are asking is typically happening in the corporate world, not happening in university, because most of the time PGs will take care of those issues and they always call us. or they put up in
Yeah.
the group or something. So I think building those relations will tell you how you communicate. One way of doing it is, if you have very good relation, just walk into the room and say this is what has happened, or just call and tell if convenient, or put
Yes,
it.
sir.
We have a groups for everything, patient care, so we can put it in that. Right? That's what
Okay.
our people are doing. If you are not in part of the system, one way of sorting it out is you tell the consultant's colleague or say secretary or something, this information kindly pass it on. If you are not yet built that relation, I think over a period of time, if you give a good information or which
Okay.
make difference in patient care, I think they will say you can communicate directly to me. That is how it works out. But you should know when to draw the line. It all depends on how good or bad your consultant is. Some people are very tough, they will never allow you. So I think you should
Yeah.
be able to recognize with your experience what is that. Some people will never be happy whatever you do. So I think
Okay.
those challenges you have to learn by experience. These are human relationship issues, okay, and personality issues.
Yeah. And also, sir, like generally the way CP would be handling most of the time by even me, I did this mistake. What and all we observe the things in a case sheet, we directly negotiate it is some like something it is a fault to any superior.
Mhm.
So instead of that, what would be the better way to communicate that this is happening? So this need to be given attention. So could you address this, sir?
Yeah, this is not an uncommon problem. Way I look at it is again it based on the relation and way I react as some other consultant will be react. I think that is the first thing you need to know what type of person the consultant is. If he's very
Exactly.
tough, I think you forego it because you might do it with a good intention, but the result
Yeah.
might be bad for you, your colleagues, as well as for the patient, right?
Okay.
So the one way to solve is spend more time, collect data, and come back
And
and say, I have observed last 1 month this many patients. These are the mistakes which has happened, and slowly communicate to them because over a couple of months they know that okay, this person exists in our team and this is what is happening. I think
yeah.
I will react based on situation rather than going one shot. Okay, this there's a huge drug interaction and completely missed out and patient is falling sick and the consultant is new to you and then you are not experienced, probably I will either work through back channels or I'll just keep quiet and keep collecting the data.
Okay.
And then say at some stage, sir, last month we had 3 cases which this has happened. Okay, good enough. What can we do about it? And choose a right moment, not in a busy OPD when ICU patients are sick or probably when you're having a small tea together or something like that. Slowly, that relation should build up. I think don't try to point fingers at everything. You
Yeah.
you look at something which is very tangible and treatable, like a very simple drug interaction which can be completely avoided. Oh yeah, this can be easily done. Go ahead and do, right? Or
Okay.
something which has very bad outcomes, patient has become very sick to it and you say, sir, this is the reason why this has happened. At that moment
Okay.
consultant may not like it because he is upset already because of all this and you're hurting his ego. So I think it has to be navigated through this process, right? First
Okay.
about your relation, how long you have
Yeah.
been working and how bad is that information for the patient and him. I think you have to choose the timing to send information. If you're not, if consultant is very tough and then you feel you're not built up enough relation, just postpone that information. Collect more data,
Okay.
slowly look for an opportunity and convey. That is the way out, I would say always. That's what I do in infection control. I will not tell anything, even though I know grossly something is going wrong, because I don't want to tell my medical superintendent, sir, these many things are going wrong. So we also face similar problems. So that's the way I look at and I work out around it.
Understood, sir. So we need to speak with data and observations instead of
Data
all of
again,
it.
sometimes in Indian people don't like. Anecdotal is good enough, but timing is important. Look for
Okay.
an
Okay.
opportunity. Yeah, and of course, collect data and say this many patients. It will not be a publication like Invest. They say you show the publication, people will change. Indian system may not work like that. Not
Okay.
all will like it. It depends on what sort of consultant you have. Some may like it, some may not like it. So you have to pick and
Understood.
choose. There's no single say that, okay, this is what is going to work. I think it's a combination with respect to timing also.
Understood. Understood, sir. Clear. And the other thing is, sir, when we are doing this ward rounds, and there will be a situation like there will be two doctors from different specialization, and both may be correct at their point. But for patient requirement or patient clinical condition, we need to drop it down one suggestion, and we need to go with another doctor's advice. So how to like make this pleasingly convey to them, and what is the good way to approach them, sir? Like you know rejecting their advice may affect their ego or something, and again it may affect upcoming days when we want to talk or when we want to be with them. So what would be the best way in this challenging situation?
Are you
So how to
talking
deal, sir?
about within the unit two different consultants or two
Yeah,
different departments, or within the within the department there is?
yeah, exactly, sir. Within the department, two different doctors.
I think that is a very volatile situation. I would say you
Okay.
should back off, right? I don't think so. Clinical pharmacy should involve. In fact,
Okay.
many times you will spoil relation with both of them, and future
Okay.
patients might in fact suffer. All the work which you have done
Okay,
might
sir.
be undone at that time, and there is a
Okay.
huge risk you might be marginalized. Say, a consultant
Okay.
might think, okay, this fellow wants to support him, this fellow, because very tricky. Your intention might be right,
Yeah, sir.
it's very tricky. So I would say a clinical pharmacist should not get involved in any of this unless some consultant says you
Okay.
write like this. I think a neutral position is always better in this. That's what I would say, because it will spoil your long term all the planning. That's what
Yeah,
my
sir, exactly.
advice will be. Yeah. Probably one way of working out is if there is a third person who is common to both of them, and go and tell this word, and can you just convey that messages to them, who himself is a doctor or working in the team.
Okay.
I think that will help. I don't think so.
Understood.
These situations you should engage. Extremely dangerous situation these are.
Yeah, sir, exactly, exactly. So in the same situation, for example, an extension to this, a false allegation has been like claimed on a CP or something, whoever it may be in a CP department. Though it is not true, but it has something like a fake allegations. So at these situations, how to approach, sir? Like argument won't work, even being so pleased won't work. This is something clinically need to be explained in terms so that they need to understand, and it should not affect upcoming days relation and the rapport. So again, how it should be done, may I know, sir?
Again, I'm telling you, this sort of situations occur only if you are part of the system, right? If you are
Yeah,
intern, you will never get this headache. If you are
exactly.
an outside person visiting, it will not happen. So if you are only employed through the hospital or a college or university, then you have a legal responsibility to do it. That is why you are caught. Otherwise, you will never be caught, because no way you will punish you or somebody. If an intern does wrong, we just shout and say, because ultimately legal responsibility will be that. But if you are part of
Yeah,
a system where your job profile says these things have to be done by you, and we expect it to do it in a quality type, in a good time and quality, that is where you end up having this sort of situation. So
exactly.
majority of the time, what happens is, in these situations, actually the mistake is a minor one, or it's not a major mistake. It is a fallback
Okay,
of some other event which you will be caught in the crossfire. Many times it happens like that, because there is some tussle happening between couple of people, and you are caught in the crossfire. Many times it happens like that. Or majority of the time there is some politics happening in somewhere else, and you are caught in the crossfire, right?
yeah,
Because this sort of things happen with our pages almost every day. I pick up finding so much, but I don't fire them and say you apologize, give a letter, all that. Every day there are mistakes, even at senior doctor
exactly.
level. So it happens. It all again depends on how do you navigate. So I think this is where trust comes, right? And
Okay,
see, it is like always when a lot of people are there, junior people are there, there's the first people to be kicked out are juniors. right or wrong.
Exactly.
However, did you do? It's like a cricket match. You fail in one
Exactly.
match, you will go however talented you are if you're a newcomer. But if you're a well-established
Exactly.
player, three, four failures are fine, right?
Yeah.
Because there's already bonding there. So similar way, one
Exactly.
way of doing it is show the sincerity, intent, and always counter check your things double, triple times because you won't get too many opportunities. Second
Exactly, sir.
thing is document everything.
Mm-hmm.
Keep it to yourself. Keep the cards to yourself and show it when it is required only. Say, suppose there's an inquiry by the medical superintendent, then it is neutral person who is doing. That time you need to have some evidence. So that
Yeah.
will come only if you start actually creating system within yourself. Okay, every time I write
Mm-hmm.
order, I'll keep a backup copy with me, a photo or something like that. Again, these are legal issues again. Or I will
Yeah.
make sure these things I will do every day, irrespective of what happens. I will maintain that quality. Then nobody can
Understood.
unphrase you because you are sincere in your work. If
Yes.
you yourself are very shabby, you're coming late and writing orders in a hurry, mistakes are repeatedly happening, then you're always caught. I think it's all about your integrity. And
Exactly.
so, if that sort of situation, this only your past thing will help you, right?
Understood, sir.
But many times it's a complex situation, as I told you. You may not be actually, you're just a fall guy for something else.
Yeah. And the next thing is something like challenges in OPD, sir. The one which you addressed in the earlier session. When we are counseling a patient and also asking them what minimum basic information like this particular source of tablet for source of indication, how to take, at what time to take. So this kind of communication won't be possible for a guy who is not familiar with the layman language. So how to like communicate this? Sir? Is it like something these days a trend is something reels or like images, something related to leaflets. So instead of that, a one-to-one conversation is very important in patient services. So in this, I have a bad experience, so I just want to learn, sir.
Yeah, so there are multiple ways of doing in 2025. I think we have a lot of avenues to work out this. One is, I
Hmm.
think the most important thing patients like is your attitude. Are you really trying to help or you just want to do the job and run away, irrespective whether you know the language or not, right?
Okay.
Once you build that
Yeah.
relation, there are multiple ways of doing it. I think, see, if somebody and 70-year-old person likes, he will never see your reels and all. Their generation never uses.
Exactly.
So
Yeah.
one way of doing it is probably use an AI for a translation voice and then try to
Hmm.
translate and see. Show your intent that you're trying. So because it will
Yeah.
translate into the local language, you can show them this is what you need to do. Because your
Yeah.
written script is in English, but if you can show them and show this what happens. Like for example, if you look at KMC, when we type out our OPD prescription, the
Okay.
orders instructions come in Kannada also, right? Like
Hmm.
before food, if I write ಊಟಕ್ಕೆ ಮೊದಲು, it will come. So
Yeah.
that sort of softwares also will help. I don't know, depends on individual hospital, but you can add that using AI. It's not so difficult now. So again,
Okay.
it depends on what sort of age the patient is on, how do you communicate to them. And other thing is, do they respect you? Because if they are people who they just want to listen to a doctor, not to you, then
Hmm.
it becomes a challenge. So you have to navigate through that situation. Yeah, but
Okay.
there are ways
Okay.
to it. I think some things won't work for certain people, some things work very well for certain things. Right? You can
Okay.
always say, I can send you this link, you can read about this. But if they don't know how to use a smartphone and they're not great in using sort of videos and all, it's not going to help.
Understood, sir.
Yeah.
Uh, Also a part of like CMEs within the hospital for hospital healthcare staff. So making them understand this comes mainly in IPC, HAI practices, if not antimicrobial stewardship practices. Bringing awareness within the team and making these things possible are so important. So when we are dealing with a nursing staff or like something housekeeping staff, we need to explain a basic stuff. So in this we can't go with English or something like that. So what is the, I saw few posters of you like regarding this celebrations, IPC celebrations 2024. So how you are navigating this issue and how you are making this very smoothly, sir?
So again, I said, see, I've been here for so many years now. Life becomes easy, right? And you have support system who have to take over that work, right?
Hmm.
You see, there's no point me teaching hi-fi English for housekeeping because they will know only Kannada here, right?
Yeah,
So I try to engage our nurses who are good in Kannada to make sure the content and the information is correct. I think
yeah.
that part you can correct it, right?
Okay,
Delivery, you
yeah.
need not do it every time. You can be a face of it, but you need not do it. You
Okay,
can attend the presentation, but ask somebody to present who is fluent in the language. And then you organize the whole program. You coordinate, I won't say organize, you coordinate the whole show. Make sure the messaging is correct. That's the way I do it. Because for me, time
okay,
and this thing is also a problem. So I'll ask somebody to do it. I make sure the content is fine, and then I go and attend and tell them summary of what is happening, right? Because you can always use
okay,
PPT for it in the local language. I think that is very important. And build relations there. Build relations. It will always help you when you're in trouble. Housekeeping, nurses, be nice to them. Understand within them there will be troublemakers. Avoid them. So slowly you
okay,
have to navigate through them. Just like consultants and doctors, there will be problems with nurses, housekeeping, but their challenges are different. But they will always
okay,
like you if you're nice to them because they also are sort of always reporting to the doctor. So you are in similar boat. So I
understood.
think building their relations will ultimately help you to build your relation with the consultant because you say if some situation comes, you can always say so that I can manage with the nursing staff with this problem. So they say, okay, great.
Mm.
So I think slowly building relations not only with the consultants and doctors, but build with staff, other staff, this is as important. For that, you need to work in the same institute for some time. You keep jumping, then it's a problem.
Okay. Understood, sir. And also, how do you like? I mean, sir, networking is very important in every domain. In a same thing, in a same way, in a hospital domain for a CP, how a networking plays an important role in communicating and dealing day-to-day challenges. Uh, like also explaining things like how you explained, dealing the situations with other guy who is very familiar with these two common people. So in this way, how you feel like networking is so important for the conveying the communication and also how important role it can play.
Yeah, I think we should be careful about it. I'm not a very networking guy, and neither I'm very active in social media. So I
Okay.
work out my own way to make sure the patient care is best. Okay, that's the way I look at it. So when
Okay.
you network with people, that generally what happens is number of people who are interacting with you will increase significantly over a period of time, right?
Okay.
So as expectations, so then you have to allot the time, then you have to know your personality. Some personalities are very good at it, you can manage their
Yeah.
act social media, they're connecting everybody. So I think it boils down to your personality. If your personality
Okay.
is not very engaging, you don't want too many people, I think you should back off and not to do this networking business. You have to know definitely certain people. Clinical pharmacy, you can't say I won't interact anybody. That's wrong. So you
Yeah.
have to know your ward nurses, be nice to them, say good morning, how are they? Then housekeeping, you interact. Your your admin people, you should be active. Show your face once in a while because they're going to pay you the salary, not your consultant. So to a certain extent, it is good. Beyond that, I
Okay.
think it boils down to your personality. Somebody is very good at it, you go ahead and do it. But you should be able to
Okay.
handle all the pressures and other things which will come along with it. If you're not, no, I'm not a very big networking guy. But I know my
Okay.
limitations. So, but within my sphere, I'm good at that. I will do it. So I think it's individual personality which needs to decide on that. I think the individual person. It's good to have, but beyond certain point, you have to realize what is your limitation.
Great. Great, sir. Great. I hope we have came to an end of the session, sir.
Yeah.
So before winding up, I just want to hear and we want to just know from you. in a one line, like what and all things need to be online for a CP. So this makes them enhancing the profession. So what do you suggest, sir?
So I would say for any profession, again, I won't say for that, is one is your intent. What you want to do, that intent you have in within yourself to do that. Second one is capability. You have that capability, do it. Like as I said, I'm not capable of handling too much of social media. It's not my capability, but I have other assets which I'm good at it. So that is the
Yeah,
second important thing. The thing which joins these two for a clinical pharmacist or a doctor is your knowledge, or your
yeah,
what I would say, your knowledge base, right? That is what connects. So
okay,
first is your intent. Are you really intent to do it? If I'm very intended to go and play for India, but do I have capability to do it? I don't have, right?
yeah,
So,
exactly.
but do for that, do I have enough knowledge to do it? I think these three are for me the most important for anything in any profession or anything you want to
Understood,
do.
sir.
Your intent and capability. Okay, I mean, I
Yeah,
might be sounding very political in this, but if you look at Rahul Gandhi, his intent is very good, but is he capable of doing it? You need that capability, right? So you can't
yeah,
say Dravid to play like somebody like Dhoni. He can never play, right? Similarly,
exactly.
he can never play as this. So intent, capability are important. What joins both of them for a profession is your knowledge. That will come with only experience and hard work. I think for
Exactly.
me, that is what it is for any profession, I would say. And intent and capability is, it's up to you, right? You know what you are.
Yeah,
Yeah, so you choose your pathways. If you're not good at being in the hospital, you can go to research side, or you can work for a something like a company, right?
yeah,
I take all this headache pleasing 10,000 people and then getting, I mean, not that great decent salary. So I think you have to choose that. So I'm passionate certain
understood.
things. I do extra mile to do that because I have intent and I have capability and I have enough
Understood.
knowledge now after 25 years to do it. So you have to have a plan. Say 10 years from now, this is what I'm going to do. I think
Yeah,
these two are important words for me in my life. That's what
very
I.
meaningful, sir. Thank you so much, sir, for
Sure,
today's session. And by taking your time in your busy schedule, thank you for giving your time.
sure,
And definitely we'll join in upcoming days, sir, for a few more sessions.
sure,
Looking
sure.
forward.
Yeah. All the best for your videos. It'll be, this is a podcast, is it? You'll put it in YouTube. Is how it works out?
Exactly, sir. Exactly.
Okay. And where did it all start with?